Okay, so if you have to place a jugular catheter in a small patient, or a patient that you just don't have any veins left in, I'm going to show you how to place the catheter and how to secure it in place. So the first thing you want to do is shave a large area over the side of the jugular. So we can pretend the jugular is on the line where the fur parts. So you want to shave an area that's at least like that large. Okay, so have a good shaved area. You're going to place your catheter towards the patient, so towards the body of the patient. And when you place it, you can either have your patient on their back or in lateral on their side, whichever you're more comfortable with. It just depends on the person who's placing the catheter and their comfort level. You may need a little bit of sedation for your patient, depending on how awake and feisty they are. So that's definitely a good thing to consider beforehand. And then what you'll do is you'll have your restrainer hold off the jugular for you. Obviously you've prepped the area first. We always use a gauze just to cover any fur that was not shaved. And then just place your catheter as if you would normally. And we always make sure not to touch the area of the insertion site because we want to keep that clean and sterile. So once you have the catheter in, then what we do is take just a 22 or 20 gauge needle. If you're using a catheter with wings, you can actually put your needle through the holes in the wings after just putting it slightly through the skin. So just take a little tiny bit of the skin and then go through that hole in the wing. Then you take some suture material. Doesn't matter which suture material you have, whatever you have will work as long as it's non-absorbable. You can thread that suture through the eye of the needle and then pull out your needle. And then you have your suture going through your catheter and your skin, and then you can just tie it off. So you do this to both sides, both wings. What you can also do, if you have some, is put just a little bit of tissue glue just underneath the hub on the flat part of the wing, just to help it hold in place as well. If you have a catheter, so I'm just going to do the one side just for time, but if you have a catheter that does not have wings, you'll notice how the catheters have little ridges on them on the hub. So what you can do is the same idea as what we just did, except instead of going where the hole on the wing was, you're just going to take a little bite underneath the catheter. Same idea, thread your suture material through your needle. And then you can tie around the whole hub of the catheter and just make sure that your suture goes between those two ridges so that it's secured in place. And then the same thing, just tie it and cut your suture material. And mine just slipped, so it's not between the two lines anymore, but it should be between the two lines. Once you've got it sutured in and glued, if you have that, then we usually put a clear occlusive dressing over top just so that we can keep an eye on that insertion site, just because being more of almost a central line in a lot of our little patients, they're at greater risk of infection with these catheters, so you want to keep a closer eye on them. And then after the occlusive dressing, you can use some cast padding and vet wrap just loosely wrapped around their neck to secure it in place. And if you have an IV line, then you can tape that to that bandage so that it's secured and not going to pull on the patient's neck.